Hello, everybody. I wanted to explain the discussion board to you a little bit so you know why I created these discussion boards this way and what the purpose of it is. As advanced practice nurses, you not only are going to be the ones responsible for diagnosing your patients, but you're also going to be responsible for educating your patients. Informed patients are able to make better decisions when it comes to their treatment plans. If they understand why you're recommending certain things or where you're coming from, what your thought processes are, you're going to have better patient compliance. One of the challenges is taking complicated medical problems and converting them into layman terms. So being able to explain them to patients on their levels at where they can understand it, that they're not really confused and complicated. Sometimes they can be simple things and sometimes they can be very complex things, but we need to be able to convey that information to our patients in order for them to understand what's going on in their bodies, and it also helps with compliance and coming up with unified goals for treatment. So what is going to happen with these discussion boards is I'm going to assign you a topic, and that's just basically to ensure that everybody gets a different topic. And I have a long list of topics, so if you don't like the topic you get and you want to maybe try something different, that's fine, as long as it's not already taken. And I will post what all has been taken, so if you want to change, that's fine. And basically what you want to do is just record yourself explaining the disease as you would explain it to a patient. So for example, I'm going to explain acne to you. So you want to do this at around a 5th grade level. That's what's recommended. There's a lot of health illiterate people out there, and even intelligent people sometimes don't understand health concepts. So you really want to do this in basic terms, kind of like you'd want to talk to a middle school age child, like a 11, 12, 13-year-old. So that's what you're kind of aiming for. So if I were explaining acne to prepubescent kid, this is how I would explain it. And I also would do this as for an adult too, because adults get acne too. So acne is better known as pimples and blackheads, and you get acne for many different reasons. One of which can be that you get it from your mom and dad. It can be inherited. Um, we know that people who have high amounts of dairy and carbohydrates in their diets tend to have more acne. So although the dairy products would be like your milk, your cheese, your yogurts, they're important to have in your diet, but excessive amounts can contribute, meaning if you eat too much of them. Carbohydrates can be things like bread, pasta, cereal, cakes, cookies, and even some vegetables like corn and squash are considered carbohydrates. So having too much of that stuff in your diet can also contribute to getting acne. We normally have different substances in our bodies called enzymes and hormones, which help us stay healthy and help us grow. But sometimes as we grow, these levels or the amounts of these substances in our body can change. And sometimes when there's a lot of a certain one, it can make acne happen. There's other things too, like environmental things, things we do to our skin, like oils, perfumes, soaps, deodorants, makeup, all those kind of things can sometimes also contribute. So what a pimple is when you have pores in your skin, which are openings where hair follicles or hairs come out. Your sweat glands, your oil glands, they all drain through these pores. And sometimes these pores can become blocked either with skin or with some of the substances that we put on our skin, like your deodorant, your makeup, and that kind of stuff. So when they get blocked, the oil and sweat and normal stuff that comes out of these pores gets trapped in there. And so the whatever obstructs it, the skin that obstructs it, makes a little tent, and that's what causes like a pimple dome. So that's what we typically know as a pimple, so that those pores become obstructed. If the oil and the sweat continue to accumulate in that, it can get quite large, and you can get what's known as a cyst, which is kind of like a pea or a bean or a nut size nodule or lump, and it can be soft and it can be tender. If that substance starts leaking out of the pore into the tissue, that triggers what we call an inflammatory response, where your skin will get red, it'll get kind of warm to touch, and it may hurt when you push on it. So that's what we call cystic acne. So when those pores become just way over distended and over full, and sometimes we actually need to open and drain them. Blackheads are still that stuff accumulating in the pores, but the pore stays open. And so the oil and the sweat and the germs on your skin and the bacteria all kind of line inside this pore and gets hard. And so that's what's known as a blackhead. So that's basically what acne is. So again, you can get it from your mom and dad. Sometimes it can be your diet. Sometimes it can be normal, natural levels of substances in our bodies. And sometimes it can be things we do to our skin. So if you have questions, please feel free to ask me. So basically, that's what I'm expecting in these discussion boards, just that you're able to kind of reiterate the information back on a level. And then what I expect in response is for you to, look at the videos and give some recommendations. Like I used hormone, and that's way too high of a level. People don't understand what hormones are. They don't understand what carbohydrates are. They don't understand what substances are. You need to just kind of find some different things to say, hey, you're a little bit above their head on this, or you did a really good job explaining that. So I want some feedback to each other on how to improve. It's very uncomfortable for me to be on the side of the recorder and record it. Recording is much different, I think, than face-to-face conversations. So I know this is a challenge, but I want to get you used to recording. Again, this is all new to me too, so I kind of hesitate and I and all a lot, and I apologize for that, but this is a learning experience for all of us. So feel free to critique me, and I will critique you, and I want everybody to help each other learn how to express ourselves in a way that patients can understand. So good luck, and let me know if you have questions. Thanks.